Hello, my name's Susan Cole and I work for the HIV charity NAM AIDSmap, and I'm going to be arguing that virtual care works well for all women living with HIV. As a woman living with HIV, I was initially quite skeptical about virtual care. As you can see from this picture with other phenomenal women living with HIV, I'm a real hugger and I love personal contact. And I absolutely couldn't imagine that virtual care could come anywhere close to the quality of care that I was used to receiving. However, through the COVID pandemic, my opinions have changed dramatically, to the extent that I can say I've had a personal paradigm shift about how well virtual care can work. Like many women living with HIV, I don't live anywhere close to my HIV clinic. It's close to a 90-minute journey across London on packed trains, heaving with viruses. I would have to take time off work, arrange childcare, and on the odd occasion, actually forced to take my children with me. I have vivid memories of my toddler being in the clinic with me and reading signs on the wall and saying, "Mummy, what's HIV?" With the virtual care I've received, I've managed to avoid traveling on public transport through the pandemic and bringing COVID-19 into my multi-generational household, especially to my 87-year-old mother. I've not had to take time off work and explain why I have these medical appointments. I'm able to be armed with the information that I need in my consultation, and my doctor is actually able to ping me over information about my concerns. My consultations now take 15 minutes out of my day rather than the half day I was used to. But don't just take my word for it. I've been speaking to women living with HIV who all feel now that virtual care can work really well for all women. It fits in so much better with family and work commitments. Women don't need to take time off work. They don't need to, worry about explaining why they're having these appointments. It also alleviates anxieties about being seen. It saves money in terms of travel and childcare. And it's also often safer to be able to talk in the safety of your own home. More women are also engaging with virtual peer support, and that's also a really important part of care. It's very much the new normal. However, I do recognize there are barriers for many women living with HIV. However, if we recognize these barriers, they can be resolved to ensure that virtual care works well for all of us. It can become integral, things like phone credit, literary tools, data bundles. They can all be given to everyone who needs it. HIV clinics can partner with community organisations that can provide safe spaces close to where the women live for virtual consultations with additional support. With best practice, virtual care can work well for all women living with HIV, and we very much need to recognise that this is indeed the new normal, so we should embrace it and do our best so it can be ever so effective. Thank you so much, and I'd like to say a special thank you to the Forum Network of Mental Mothers who've helped me with this presentation.